Hello everyone. Today we are going to talk about stem cell therapy for degenerative arthritis. Do you suffer from roughness in the joints and tried all the painkillers that did not work? Do you want a cure for osteoarthritis without the need for surgical joint replacement? Recently, researchers have begun to look to stem cells for orthopedic conditions such as degenerative arthritis. Successful stem cell therapies thus far have resulted mostly in pain relief and improvement in functions or quality of life. So what are stem cells and how can they be used in the treatment of orthopedic problems, as well as what are the benefits and costs of these technology? All these questions and more will be answered in this video. Our role today is to answer most of your questions regarding stem cell therapy for degenerative arthritis. Today we have Dr. Young, who is a leading doctor at Medrex Hospital. He is going to discuss with us everything about degenerative arthritis and stem cell therapy from an experienced medical point of view. Hi, I'm Ume. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Hello, Dr. Young. Nice to meet you.
네,
Yes,
안녕하세요.
hello.
Dr. Young, can you please introduce yourself?
Hello, I am Yang Hyuk Jae, an orthopedic surgeon and the director of Medrex Hospital.
So, first question. What is degenerative knee arthritis?
Inside the knee, there are muscles and bones surrounding the knee, and there are tissues called cartilage and cartilage plates. After being injured, fracturing bones or damaged bones due to sports, tearing cartilage, chondrocytes or ligaments, excessive use of the knee eventually causes cartilage to fall out and bones to be exposed, causing degenerative arthritis. In the end, degenerative arthritis causes pain by hitting bones directly.
Okay. So what are the usual causes?
Like I mentioned earlier, the cause of degenerative arthritis could be a ligament or torn cartilage plate, and the sippy knee may be the cause. And there are also cases where the cartilage wears out faster, as patients who have been injured once due to sports damage or have fractured their knees excessively use them again. In addition, arthritis can worsen as people who bend their knees, do a lot of climbing and going up and down, or do a lot of heavy work repeatedly, or do a lot of physical labor as they get older.
So does it have any symptoms?
There are many symptoms. Arthritis has several symptoms depending on the early, mid, and late stages. In the early stages, the knees are sore and the knees make sounds. And there are cases where you feel pain when you do a lot of walking and activities. In the midterm, you can complain of great pain where you go up and down the stairs, especially when you go down. It is difficult to go down the stairs, and you have to hold the stairs one by one and go down. You should suspect the midterm. And when you see a person walking from the back, the person walk wobbly, or legs look like an X or O shape, etc. If the person barely can sit and stand up, cannot walk more than 30 minutes, feel severe pain, wake up with very severe pain at night, you may be in the final stage of arthritis.
So is there a way to prevent knee arthritis?
Arthritis is a disease caused by a very thin cartilage of about 3 millimeters, falling out and getting sick. Once the cartilage falls, the cartilage cannot be regenerated. And since the joints continue to worsen due to degenerative properties, most of them have to undergo artificial joints or major surgery if the cartilage falls and the bones are exposed. However, with the recent development of stem cells, regeneration therapy and injection therapy, cartilage can be regenerated sufficiently with injection or drug treatment if the cartilage is cracked or slightly damaged in the early stages. However, arthritis is a disease that continues to progress once it occurs, and eventually worsens and requires major surgery. Therefore, in order to prevent arthritis in early stages, it is the worst to do a lot of exercises that you don't usually do, and such excessive exercise causes cartilage and ligament damage. Therefore, it is important to maintain an appropriate weight without exercising too much. As you get older, complications such as severe obesity and diabetes accompany a surge in weight, which affects knee joints, hip joints, and ankle joints. Therefore, it is important to take good care of your body and control your weight to prevent obesity. And above all, the most important preventive measure is to maintain muscle strength through proper exercises. Muscles gradually lose weight after their 40s, resulting in muscle loss, which eventually exacerbates degenerative diseases and deforms legs, leading to arthritis faster. Therefore, maintaining good health care from the 30s to 40s to maintain muscles properly and control weight is a good way to prevent arthritis.
How about diet? Is there any special diet to follow?
Young women often force themselves to diet for weight control purposes, and in this case, most of them lose muscles first by controlling their diet a lot. Excessive diet without simultaneous muscle exercise can lead to arthritis even if you are young. Therefore, proper exercise is important when dieting.
Okay. So is it possible to do an exercise therapy?
Exercise therapy is important. Depending on the stage of arthritis, some doctors recommend patients to never exercise. But in fact, exercise is necessary. In the early and mid-term stages of arthritis, consulting with an expert and performing various exercises that do not weigh on the knee can relieve knee pain and prevent arthritis from progressing.
Okay. So who is more likely to suffer from this disease, a woman or a man?
In general, women have a higher risk of arthritis. It is presumed that this is because women do a lot of housework or sit with their knees bent, and women have 60 to 70% more arthritis patients than men.
Very high, okay. So I've heard about something called stem cell therapy.
Stem cell therapy is the latest treatment and can induce cartilage regeneration through stem cells. Although this treatment is often controversial among many people, and even doctors, stem cell therapy can be very effective in the early stages of arthritis, according to the most recent paper. In addition, treatment accompanying stem cell therapy can show good effects in early or mid-term. There is also a possibility of complete recovery depending on which state of arthritis I am in consultation with an expert.
So, knee arthritis, does it need surgery or can it be treated with only stem cell therapy?
In general, not all patients need surgery. In the early or mid-term of arthritis, good results can be obtained through exercise, procedure, and injection therapy. But not everyone has the same good results. Therefore, you should check with your doctor whether you are a person who can improve arthritis in this way or whether you can treat it only through surgery.
All right, okay. So how should I manage after stem cell therapy? What kind of behavior should be done afterward?
Stem cell therapy involves implanting cells. So stem cells are mainly inserted, such as liver transplantation or surgery. Proper rehabilitation is essential until the cells settle and settle. Therefore, it is necessary to follow up and observe the process of cell settling well, so that the knee is not impacted along with maintaining muscle strength for the first 2 to 3 months. During such a process, rehabilitation must be carried out with consultation with experts, and rehabilitation is so important that surgery is 7 to 80%, and rehabilitation accounts for 30%. Therefore, you should consult with an expert to see if you need more exercise or if your cartilage cells fall off because you exercise too much.
All right. Thank you, Dr. Yang. It was very informative. Thank you.
Thank you.
감사합니다.
Today, the doctor explained in detail everything related to stem cell therapy for degenerative arthritis, such as benefits of it and how can it be done. Thank you for joining us once again today at Cloud Hospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.